Hi, this is Adam Ballinger, and I have another quick for you. And this is a supplement to some of the trainings that we've been doing and I know are going to get into a little bit more. So if you're in some of the trainings, this is some of your take-home stuff to watch and rewatch and apply it to the things we're going to talk about in our sessions. If you're not in one of the trainings, I hope you enjoy this. I'm making this open to the internet, so have at it. This is a little bit of an introduction to knee biomechanics. It's not essentially an introduction to all of the anatomy of it, but part of the biomechanics. And we're going to get right into the topic we'll be discussing in some of the trainings. So for this, what we have, these are both supposed to be left legs. And this is the knee quadriceps, knee, lower leg compartment, toes. This is a little bit of a drawing of much more the inside of the knee, and I'll get to that in a moment. So the thing that we're going to be talking about is a little bit of a movement concept. This isn't necessarily like some of the biomechanics, muscle chains and fascial lines and stuff like that. This is just a little bit of an explanation for some of the biomechanics. If we were to look at the hip, and we'll say that there's a gluteus muscle that's out here. This would be the iliac crest. And then on the inner leg, coming all the way down below the knee or into the inner knee stuff, we have our adductor system as well. So we have these muscles that are way up high, and they come all the way up and they attach to the base of the pelvis, to the upper outer rim of the pelvis. So we have our adductors and our glutes, and they're really, really quite high. One of the things that this does, and we can see this a lot of times on the yoga mat, by how somebody's knee moves when they do yoga poses, sometimes what we'll see is that a knee tracks inward quite a bit. So if we see somebody doing like second warrior pose and they turn open to the side, a lot of times that front knee falls a little bit to the inside. One of the reasons why it goes and it follows the direction you're rotating is because it's connected. Some of these adductor muscles that come all the way up to basically the ischial tuberosity or the sit bone area, they come all the way down to the inner knee. So if somebody rotates to the side to come into a side angle pose and the knee follows, one of the things that tells us is that the pull of the adductors and the fascia related to it is dragging the knee to the side. And you can look at that as a couple of different ways. One is we can say that the inner thigh musculature is too tight to allow the knee to stay open in that directly forward facing position. And we'll talk a little bit in just a moment about where should the knee exactly be and the fact that people have slightly different shaped bones. But for now, as you rotate to the side, because of these adductors, the knee and the whole leg gets pulled with it. Because the foot is planted on the ground and it has some force into the floor, usually this moves a lot more than that. In fact, rarely does somebody turn over to the side and their entire foot slides over. So what we'll see is that this is fairly steady, and when they rotate, the lower leg being much more weight loaded into this, it stays a little bit put, but because of this connection up here, we'll pull the femur to the side. Now that's a little bit tough if we see that, especially if we practice that again and again and again. We begin to create a little bit of a flexibility in these lateral collateral ligaments in the knee, and potentially even some of the ligaments that are inside the knee. Because this part down here is more set, it's more stable, and this part up here gets pulled, we tend to see that there's a rotational difference, that the top part of this tends to rotate quicker than the bottom part. Either way, when the knee falls off what we might call the center of base, if the knee does come this direction, any action to push down through the leg so that we can come up or stabilize ourselves, if we push down and the knee has rotated and say the knee is much more over here and the base is over here, now when we push, we don't have this direct line of push towards the base. And that creates a really ineffective or inefficient power thing. If you want to push down and create stability or push down to help come up out of a pose, having the appendage directly, like pushing straight down to go straight back up is the most efficient and effective. In addition to that, if the knee has fallen off center, then you do apply, well, there is going to be a weight load on it, or let's say you try to use your muscles and push push out of the pose, push into a deeper angle. If we have this rotation piece, we apply a force into something that's rotated right here, and I hope I've made my case that this rotation is probably not wanted for the longevity of the joint, let alone for the function of the leg. If you push down through it like you actively use the adductors or the gluteus muscles, we could actually cause more of that rotation. Okay, so as we turn to the side, tight adductors might be part of the reason why the knee falls out of place and why you might want to change that, or the explanations I just gave. Another reason why the knee might fall, rather than just thinking something's too tight, these muscles on the outer hip, part of these gluteus muscles that are called our abductors because they pull away. The inner thigh muscles are the adductors. We could also say that when somebody turns to the side for Trikonasana, Parsvakonasana, Virabhadrasana 2, a number of different yoga poses, that they don't use enough of the active glute muscles that help pull to the outside. And if we're turning this direction, the action of pulling the knee this direction might be what keeps it in that direct line forward. So we can look at why the knee falls or collapses in these two different directions. Might be because this is too strong or too tight. Might be because this is too weak or underactive or too relaxed. And those are different ways we can look at this. Now, either way, when that knee gets out of position, if we see the top part of the knee, like the condyles of the femur, if we see the upper portion rotating more or faster or earlier than the lower part, then we can develop either an ineffective pattern or some laxity that might not be serving later. It doesn't mean that you necessarily fall out of the yoga pose. It doesn't mean that you even feel pain. If we were to look inside the knee, there's a lot of rotation that can happen that might put stress on the meniscus, but if you have good healthy meniscus in there, you probably wouldn't even feel it. And even if you had worked through some of the meniscus, the hyaline cartilage that would be hopefully covering the bone would still give you this aneuronal, avascular cushion before you would feel much of that pressure of the bone rotating on top of the other bone. So you don't always feel that twisting. So if you're just listening to your body, sometimes you also have to look and listen with your eyes as well. Okay, so we have that falling to the inside. Now, a person who just turns a little bit and then he falls a lot, that might be a lack of awareness. But we also might be able to see when a person just turns a little bit and the knee falls a lot, this might express a tendency that they have in the way that they move their leg or their appendage. And we can look at that and use a yoga pose as a beautiful place to observe a movement pattern or habit and maybe decide like, oh, hey, maybe we should develop some of this musculature and the coordination. Or maybe we should develop a little more flexibility and range of motion and then develop that coordination. So it becomes a really good opportunity watching how the body moves there. Okay, part 2. So we have this, by the way, not part 2 yet, other color. So we have this interaction between the outer hip and the inner thigh, and they tend to have a crisscross pattern. If the outer hip works well enough, it pulls the knee in. If the inner thigh is too tight or too aggressive, it pulls the knee. This pulls the knee out, this pulls the knee in. So we have this kind of cross way to look at it. An underactive glute and the knee will probably fall in. A really strong glute and it'll pull the knee out. If we're just going with like not enough strength or dominance and things like that, the overactive quad or the really relaxed quad, the knee will flow out. The really relaxed outer hip muscles, the abductors, the knee will fall in. So we have a little bit of a relationship there that we can look at. Now the next one I wanted to talk about was from the bottom part of the body. So we have a lot with the adductors and the glutes that help direct the position of our knee. If we were to look at the bottom part of the body, we also have a very similar situation. See if I can get the right color here. Where we can look at the lower leg compartments and have a very, very similar discussion. If we were to look at the ankle work, and the easiest way to look at this is just if you were to watch at the front of the ankle, if an ankle rolls to the inside or to the outside predominantly. And we see these quite a bit. I think that I see a lot more internal rotation. As we roll towards the inner ankle, we tend to pull this into a rotation. If I roll to the inside, remember this is a left leg, so this is the inner edge of the foot. If we see an ankle that collapses to the inside, it's going to be pulling this direction. And what we'll see, either direction of that pull, sometimes we see the entire knee shift, either to the outside or to the inside. And sometimes what we just see is we see a little bit of a rotation in the bone. We see, it's hard to visually identify if the entire leg doesn't lean out or lean in. But sometimes you can even see, by some of the landmarks, you can see that there has been a rotation that's been created just in the tibial plateau, where the condyles come in and meet in our meniscus. Hopefully you still have meniscus. So we have this crisscross pattern where for our knee function, and I'm not going over all the musculature of the ankle because it's quite complex. There's quite a bit to how and why the feet roll in and out. But I would really encourage you that there's a little bit of flexibility here, often that helps, but a lot of this is strength development. So if we have an ankle that's rolling to the outside, it's a little bit more complex than just saying, working the adductors or abductors. But when we see an ankle falling to the inside or the outside, there is a lot of strengthening that can occur. And if you've seen any of the video clips or been in workshop where I've talked about foot and ankle biomechanics, that is exactly what we use to begin to work on the direction that this tibial plateau rotates, maybe bringing it back towards what we consider to be a center. That's the same stuff that we also use for ankle stability, arch development, and things like that. So we have this crisscross pattern where the knee is right in the middle. So sometimes when you see a knee falling to the inside or outside, or even if we're just in something like Ardha Chandrasana and somebody is rotating and you see part of the knee twisting, we probably see the entire knee twisting. But if you were to look and go like, well, I see the knee rotating, is the ankle collapsing? And if the ankle's not collapsing, then you have a little bit of a hint that maybe more of that rotation is coming from up above. If we see a large collapse down the foot and ankle, we know that that's a contributing factor as well. So in your knee biomechanics, the short lesson from today is, in order to get that knee to track in a forward direction or to track in whatever the direction the foot is working. So if I do turn my foot out to the side, which we do a lot just walking when we decide to change directions, we definitely want that knee to track more in alignment with the foot. The factors in that, if we're thinking of flexibility and stability and coordination, is that we have these contributing factors that relate to how we push down in the foot and ankle and the different musculature that's related to that. And if we go through a longer biomechanics session, we can track a lot of those muscles and relate them to the rotation that we see in the lower leg compartment. In the upper leg compartment, we can look at a combination between the outer hip and the inner hip muscles and the inner thigh muscles, adductors and abductors. If we add into that a little bit more of the hip flexors and the hamstrings, we can also look at some of the very complex biomechanics that are related to rotations in there as well. So not just adduction and abduction, but a lot of muscles that actually lend to the rotation there in the appendage. Okay, so if we're looking at knee biomechanics, it is a combination of your foot and ankle and your hip. Exactly what to condition and how much, that would depend on an individual person. And when we look at the knee and it begins to track in interesting directions, maybe unwanted directions, to begin to look and go, is this more of an upper or a lower leg compartment issue? And then to begin to get a little bit of an idea of maybe what we should avoid. Maybe I don't have the strength to turn all the way open in second warrior pose and still have my knee forward, or all the way open in Ardha Chandrasana. maybe I can get an idea of some of the places I can begin to develop more strength so that those poses are something I can excel at and even practice more stability in there. So we can take that stability and we can turn that into all sorts of skill transfer. You can do it in other poses or other situations in life. The last thing I want to touch on is a little bit of this concept of the bones. If you've seen stuff out in the yoga industry or biomechanics or movement trainings and stuff about the unique nature of bones, if we were to take a whole bunch of different tibias and femurs, tibial plateau, which is what most of your knee rests on, all of your knee rests on, and then the femur and the condyles that come on down to it. If we were to look at 10, maybe even just maybe 100, maybe to get really, really clear, we would see that there is a lot of difference in the shape of the bones. So if this is our femur, I didn't quite draw that to spec, sorry about that. That's a little bit better. Looks a little bit like Snoopy. So if we were to look at that femur, and we could do this with arguably all the bones in the body. The skeleton that I use a lot in trainings and workshops is pretty much the same skeleton that I see in most of the studios, sometimes even in foreign countries as well. And they've built this skeleton in a box and said this is approximately the average shape of the bones and the angles of the bones. But if we really get close and look at that, and you can find some online pictures and images, I'm forgetting his name, but there's a very popular gentleman from Yin Yoga who does a great presentation on this. I'm forgetting the name. If this is up on YouTube and you see it, feel free. Paul Greeley. Now you don't have to post it on there. Paul Greeley. But if we were to look at the shape of this bone and we took a number of these, what we'd start to see is that some people have a shorter neck before they get to the head of their femur. Some people's femurs are at a different angle as we go down through the bone. If we were to say that this is, the shape of their upper part, some people just have a natural twist and rotation as we go down the shaft. And so if we lined their knee up, if we looked right at the inside of the condyles and the tibial plateau, and we lined it up for the health of that, what we might see is a really different angle at the head and neck of the femur. We also might look down at the tibia and see the exact same thing, that some people in their tibia have an entirely different amount, I messed up the bottom, that they have a really different amount of rotation as they go down that tibial shaft. Because of that, it's really hard to say, in fact, I wouldn't promote this anyway, that you should always have your foot going in exactly the direction as your femur. And this is one of the ideas that is pretty common for a while. And if your femur went this direction, then your foot should be pointed in this direction as well. We should have your toes, generally something right inside the third toe, going the exact same direction as your knee. And that was really, really common. Now, because we don't know the exact inside of the joint, it's hard to say that that's the healthiest. And it's very easy, if somebody had quite different bone rotation angles, that if you force them or encourage them to do this, they would be creating twist within their own knee. And that wouldn't be a very healthy thing. It might never have an injury, it might never cause a problem, but it increases the odds that we develop some complications. So, here's what I would offer. There are, if you go through a lot of trainings, there are some minor things that you can look at. You can look at some small landmarks and get clues. As a generality, the foot pointing more the direction that the femur goes is a healthy movement concept. And the basic reason on that is your foot is part of your walking and it's intended to help you push down and launch you forward. So if your foot is traveling that direction and part of your knee is traveling that direction and you're walking that direction, every time your foot pushes, it creates a little bit of a turn all the way up through those joints. And even if your joints are built for rotation, that's going to add to some torque in some of those joints. Now, if your bones are shaped that way and you force them straight ahead, again, you'll also add torque into some of those joints, and this could be even worse than just having your foot go off to the side. So there is an intent, there is a good reason to begin to orient the appendages into the direction that you're moving, and that goes all the way down to the tips of your toes. But with that curveball of potential different bone shapes, we have to be really careful in forcing that situation. Here's one of the things that I can tell you. When we go to walk or squat or sit or stand up, there are some pieces. Now this is more for something, if you're walking up a flight of steps, we can take each step as an individual basis. If you're squatting and standing up, if you're sitting and standing up, and to a small degree some of the walking stuff. There is an important thing. If your foot is here, the best place for you to push down is with your knee over the foot. And that's just a physics thing. If I'm going to be using muscles and creating a downward force, I want that downward force to go as directly down as possible. If I'm walking, my knee goes out over my foot, there is a downward force at slight angles. And if I want to go forward, part of that downward force could lean a little forward and then push down and back. And that'll help me go forward. But if I have a knee, say this is our estimated vertical. If I have a knee that is much more over here, and my downward force coming through the knee travels this direction, that's going to make the knee slightly go this direction. Every time I use the muscles to push, it might be only moments and it might not be very intense, but given a lifetime or an intense activity, every time I go to push down, I'm going to push the knee and displace some of these tissues even more. Now, I don't always have to rotate the foot the exact same direction as the femur. By the way, this also plays out if your knee is too far off to the side. There's a little bit of range that we can do with that. But usually, your best power place is to push directly down. So whether or not you rotate the foot so that it's the direction of the femur, that's a hard one to say. Whether or not we should do that, I'm going to tend to say very rarely am I going to go in that direction as a yoga teacher. But I am definitely going to promote, even if the foot is slightly rotating and it looks like the knee is in a pretty healthy alignment, I want that knee right in that target zone, right above the foot and ankle. That I definitely want to create. So if I do that second warrior pose and I create a habit and a tendency to move my knee out from being above the base, I've lost a lot of my function and power and durability and things like that. So I definitely want to try to get that knee over my base. On the back leg, it's an extended leg, it's a little bit different. But on that front leg, anytime I'm in that lunge or squat position, I definitely want to get that knee to come more up over the foot. If I'm in chair pose, there's a certain amount of the knee going forward that comes into play, but I still want the knee in that same line as the foot, even if from the side, I've taken the knee slightly forward. And that's a whole other discussion and the flexion and extension stuff. Although I did do a report that might still be out on the internet about an overhead squat thing. That's an old assignment, and if you do catch it, I hope you enjoy it. There's a little bit of humor in it. So the forward direction, that's a different topic. This is looking in and talking about some of the biomechanics more in the rotation. So one more time, whether or not you want to tell somebody to rotate their foot exactly the direction that their femur goes, that's something that I've loosened up on a ton in the last 10 to 15 years, and it seems to be going fantastic. In fact, I think we've done better without trying to make everyone's feet go in that forward direction. That said, we see all sorts of other tendencies where the knees fall in and out, which is what we talked about earlier. And that breeds all sorts of problems. So minimizing how far they go, maybe developing the flexibility and the strength to not just minimize, but maintain the position so it doesn't keep getting farther out. Or possibly, although this isn't always the goal, sometimes it happens, developing the strength and mobility, the coordination and the habit to even return it back to a habit where we do center that up for that much more direct line of push straight down through the foundation. And if you're into all this, this does increase the stability of your foundation. This can help with things like ground force react, creating a stronger ground force reaction and things like this. In yoga, sometimes you hear the concept root to rise, which is still push down in order to help things either go up or push down so that you can go down with more control, or push down so that you stop falling down. So all of those depend on the positional relationship that we have in these bones and parts of the knees. All right, there's your intro to knee biomechanics. I hope that helps out. It doesn't necessarily tell you how to do a yoga pose, but it might give you some food for thought in what you do in the yoga pose and why you practice the pose the way that you do. All right, this is Adam Ballinger.